Good morning, everybody. Welcome back to the Sunday morning session, kind of closing session. My name is Matt Holmes. I'm on the PIT committee and serve as a member of the Person Development and Wellness Subcommittee. Our next session is going to be a leadership presentation by Dr. Mark Williams. I probably should be talking to this thing. Dr. Williams is a past president of SMA, and he's recently rejoined UAB as associate professor in anesthesiology. He's previously served as a chief physician officer for Bozeman Health. He's been a chief clinical officer and chief academic officer for the Prisma Health and the University of South Carolina in Columbia. And he graduated from South Alabama, represent. Where else am I? And then in 2016, he was honored as a Distinguished Alum of the University of South Alabama and is recognized as one of the 50 people of influence at the 50th anniversary celebration of the founding of the South Alabama College of Medicine. I can welcome Dr. Williams.
Thank you very much. Well, thanks for having me here. I've already met some of you, and really appreciate you joining the Southern Medical Association here. Randy and I go way back with this organization. In fact, I think it was in 2011. I think we had Williamsburg, Virginia. We had a meeting in Williamsburg, Virginia, when we were talking about physician leadership. And that was during healthcare reform and all this stuff. And I can remember that we had scheduled some extra sessions there for leadership for doctors. And it was scheduled in a room maybe about half the size of this. Well, right before that session started, SMA members, the doctors, start streaming in. And they keep streaming in. And we had to stop the meeting 10 minutes because the room was now had at twice capacity. And we had to move it to a big, much larger room. But that was when doctors were starting to really get interested in what physician leadership meant. So we've come a long way in that decade. But part of what I'm going to share with you today is leadership skills. We talk about transactional leadership. We talk about servant leadership. We talk about different leadership models. But I'll contend that certain leadership traits or skills will be more valuable under certain conditions than others. And so what I'd like to share with you today is what are those conditions that I see that you all will be working with and facing, and perhaps which skills will be most valuable to you. Now, a lot of people think I've sort of been schizophrenic in my career, but I'm going to tell you this for a reason. So I've been in medical school, law school, business school. I've worked for 9 healthcare organizations across the United States, and I used to be the chief medical officer for Alabama Power Company. I'll contend that it's not so much schizophrenia as it is curiosity, and I'd like to talk more about curiosity today. So congratulations on all the work that you did this week and all the investment of time that you put into the abstracts and works. I assume that you were curious about these things that you shared with us this weekend, right? And so if you were to characterize the conditions that you all will be dealing with in the next couple of decades in healthcare, I found this headline from the LA Times, which kind of summarizes what I think are the two of the major issues facing those in healthcare. One is lack of access, affordability, and are we getting the right care? And the other is a loss of trust in the presumed trustee. And I think most of us still think as the trustee for patients should be physicians, right? Another term that's used for trustee in this situation is fiduciary. Perhaps you all are familiar with that term. So I think if I was 30 years of age and I was just starting off, this is what I'd learn a lot about. And I'd begin to think, what kind of incremental changes can I participate in to make a difference? So you all know the basics about U.S. healthcare. The largest, most consequential part of our economy. We're spending $4.5 trillion. In 2 years, we'll spend $6 trillion. 11% of all American workers work in healthcare, much higher percentage here in Birmingham. 24% of government spending. Health insurance is the largest portion of non-wage compensation. We'll come back to that in a minute. Healthcare administrative costs are the highest of all advanced economies. There's a joke out there in the administrative discussion that if you go to Duke Hospital, and Duke is a great place, has about 900 beds, they have 1,100 billing clerks. And of course, the United States, as you know, of the top 33 industrialized countries, it is the only one out of those 33 that does not have universal health care coverage. These are some examples of other countries that have universal health care coverage. And of course, that can be financed either through a private mechanism or a government mechanism. So we spend so much money. Where does that money go? And I'm just giving you some context as we get further into the discussion. 340 million people about the United States. We spend $13,493 for each person in the US each year on healthcare. Hospitals get a big chunk of it. Physicians get a chunk, and you can see it goes all over. Boy, it's big business. It is big business. It's a business. Was it always meant to be a business? What do you think? Boy, is it a business. So 20 years ago, if you had looked at, say, Forbes, and you would have Googled top 10 companies in the United States by revenue, you would have found one pharmaceutical company. Now, 8 of those 20 are healthcare companies. United Health, which many people say is American healthcare now, its revenues lag Apple only by a little bit. We got United, CVS, McKesson, all these companies. If you're looking at it from a family standpoint, so we're looking at it from a country standpoint. The average family, according to the Milliman Medical Index, what they pay for healthcare, counting insurance premiums and out-of-pocket costs, is now $32,000 for a family of 4. It's going up 6 to 7% each year. And if Randy or anybody that owns a company will tell you, the struggle each year for every company is how do we manage our ever-increasing health insurance cost? How much do we pass on to our employee? How much do we raise co-pays and deductibles? And we use this funny term called consumer-directed healthcare, but consumers know nothing about healthcare, so that's a little bit of a misnomer. So out of curiosity, I looked at how much had I invested over my 40-year career in health. So you can go on your Social Security statement, and it shows how much you paid into Medicare. It shows how much your employer paid into Medicare. So mostly single wage earner, my family, 40 years of employment. I finished training here at UAB in 1984. I paid $450,000 into Medicare. I paid $480,000 into Blue Cross Blue Shield premiums. So I paid almost $1 million into healthcare. Check it out on your own sometime, see how much money you all are putting down. So I said, what if I had taken just 25% of just the Blue Cross premiums, just put them into a diversified stock portfolio, and sat back for 40 years, and during that time, the stock market returned 11.6%, I would end up with about $1.3 million right now, which would easily fund all my future health care and other, possibly for many people, retirement costs. So where does the US, stepping back to the macroscopic view, well, we spend twice as much as the average of all the high-income nations. So that's the US in the green. We spend $4,500 more than the next 2 highest, which is Switzerland and Germany. And of course, this is contrasting GDP per capita on the bottom line and healthcare spending per capita on the vertical line. So you're saying, and man, we spend that. If you spend a whole lot of money on something, if you decided to spend more money on A versus B, I guess you'd expect to get more out of A, right? If you spend a lot of money, you're looking for a return on that investment. So here's one measure of the return on that investment. We have the lowest life expectancy among all those countries. We will spend more of our fewer years in an infirm state. And if you live in Alabama, your life expectancy even shorter and more years in an infirm state. You can look at any wide variety of metrics other than life expectancy, and you'll come up with the same thing. At the end of the day, you're asking yourself, what are we getting when we invest so much in healthcare? This is your huge opportunity, guys. Anybody still keep up with the New England Journal of Medicine? Is that still? Okay, so Arnold Relman at the upper left there, he was the editor of the New England Journal of Medicine for 17 years. He was known as a very hard-nosed guy who only let certain articles get into the New England Journal of Medicine. There was never, ever going to be any fraud on his watch. He made sure that the articles demonstrated the reputation of the Massachusetts Medical Society and New England Journal of Medicine. But early, around 1980, he wrote a special article in the New England Journal of Medicine talking about the medical industrial complex. And of course, you're sitting in the middle of a giant medical industrial complex here in Birmingham. It basically displaced the steel industry within a decade. And he commented that it may be more efficient than its nonprofit competition. Health insurance companies basically became for-profit in the 1970s, but all the health insurance companies, the original Blue Crosses, were meant to be not-for-profit. Just a little history. But when you have this big complex, it creates problems of overuse, fragmentation of services, overemphasis on technology, and cream skimming. And it may also exercise undue influence on national healthcare policy. But even then, he said, but shouldn't this all be under the control of the doctor? I mean, there's nothing that takes place in healthcare without a doctor's order, right? For the most part. So why can't doctors control all this? Well, he wrote another article. He wrote a lot in the Atlantic in March 92, what market values are doing to medicine. And of course, the medical industrial complex had grown beyond his wildest nightmare. And he said, well, our doctors are no longer really doctors, they're businessmen. And patients are not our patients, they're our customers. And with such a system, we will no longer be able to trust our doctors because the bond of fiduciary responsibility will have been broken. Now, Arnold Relman was a very interesting man if you ever want to read his history. That's a picture of him. And that's, let me see, the name of that book, that article was, let me see. He broke his neck. He fell down steps, and he wrote a book called, On Breaking One's Neck. That's what it was called. Sorry, my mind's gone. So he coded 3 times during his hospitalization, required prolonged rehabilitation. There he is on a ventilator with his wife, who is the successor editor of the New England Journal of Medicine, reviewing articles while he's in the ICU. He eventually died of malignant melanoma. But in his book, he said, I benefited from all this technology. I can't recall the single name of any of my doctors. The nurses made all the difference. The nurses were the ones that spent time with me. The doctors just sort of went by the door all day long. And he said he spent 6 decades in medicine and he never appreciated that. So, we all measure honesty and ethics in different professions, right? And you've heard the Gallup polls. And you have to understand, you all know that COVID impacted trust of institutions to a tremendous degree. So, but you can see that if you're a physician, you're still held in fairly high regard, but diminishing quite a bit. In fact, diminishing more than any other profession over the last 4 years. Minus, I can't read that, I think 14 points over those 3 or 4 years, even after COVID. Why is that? Anybody have any idea why? If you take the COVID out of it, why would we have less trust in our doctors? You don't have to answer that.
Relationship.
Mm-hmm. Yeah. It's an opportunity for you guys, I'll tell you. What about in our overall healthcare system? Do people trust our healthcare system? Not a whole lot. In fact, consumers see a healthcare system that's big, profitable, and self-serving. And in popular media, they hear it has failed to improve life expectancy, imposed medical debt on 2 in 5 households, and addicted a generation to harmful drugs. I've been around a long time. I did an internal medicine residency too here at UAB. And on Friday afternoons, there was the drug companies all invited all the internal medicine residents over to the VA. and you walked into the room and there'd be drinks. I mean, there'd be food, there'd be snacks. Occasionally there was even wine, and there'd be little gimmicks, little things to measure the EKG. There'd be little flashlights. There'd be all kinds of stuff. And then there'd be the reps from all different companies. And boy, oxycodone, the best thing for pain medicine now for your patients. It was hawked so much during my time as like, hey, listen, these are long-term things. They won't be addictive. This is what you need to switch to. So if the medical profession tries to sort of withdraw from taking some blame from that, that's not true, because we suckered right into it. Just an aside. So let's say you live around the country. I have a lot of friends that live in Germany and China and different places. Trust in healthcare by country. I have a friend who's a rancher, and he grew up on a ranch outside of Yellowstone. And he went to Montana State University, got a degree in international business. His name is Todd Jackson. He runs an international consulting firm in Beijing. He's got a daughter. She's in Girl Scouts in Beijing. And so we stay in close touch. During COVID, he said there was no way he would ever bring his family back to the United States. He felt so protected in China, even though they went to some extreme methods. He just felt secure that he would never come back to the U.S. And this is a conservative, red-blooded Montana rancher guy. And so it's worth, again, thinking about these things. You don't have to agree with all these, but kind of interesting. Who pays for healthcare? When I say who pays for healthcare, what comes to your mind? Who pays for it? Insurance. Yeah, that's what most of us think. We do. Employers. Yeah. Every single one of you is pretty much paying every single dime in healthcare. It all comes out of the private household, right? So if you go to work for UAB or anybody, you look at your paycheck, I guess you get it every other week, I guess. I can't remember. Mine comes monthly. I'm on Medicare, so I don't like to pay attention. But if you look at your paycheck for a young person, you'll see $600 coming out of your monthly paycheck for health insurance, right? And you're thinking $600. Well, I mean, not so bad. But then you don't realize that your employer is paying 3 times that. You're paying 25% and the employer is paying 75%. Now imagine if your mind might change if the employer put on your paycheck how much you were really paying, how much he is not paying you in wages because he's paying it to an insurance company. Would you start to pay closer attention to healthcare costs? Because all of you are paying for all of healthcare, either through taxes, through insurance premiums, or through what the employer cuts your wage to pay their share of the insurance premium. Does that make sense? So remind me, who's seen that before? Okay. Are y'all Ted Lasso fans? I've watched that a lot. And I watch it because I think it has lots of lessons for leadership. But be curious, not judgmental. I got into that a little bit, and I started reading the fine print under some of this stuff. And he says, it says in there it's Walt Whitman, right? And it may have been Walt Whitman. But where most people really think came from was an advice column a number of years ago in the Charlotte Observer. And the person who was wanting the advice was writing in saying, I just discovered oral contraceptives in my 17-year-old daughter's bedroom. What should I do? And the advice was, be curious, not judgmental. So if you want to look that up, there, I got the advice column, it's right there, but that was kind of fun seeing where it really came from. Let's see. Oops, I might be stuck. Yeah, here. Oh, good. Okay, thank you. I've never gotten into the Windows operating system either, so just so you know. Right? So curiosity killed the cat. They used to think that people who were curious were scatterbrained, right? Years ago, 1930s, Eleanor Roosevelt, First Lady of the United States, husband served 4 terms as president, wrote an article in Saturday Evening Post in defense of curiosity. By the way, when I opened up, I got that Saturday Evening Post, and I got the second page, and there's this cigarette ad. I mean, you look at the old cigarette ads, and they blow your mind as to what would not be allowed today. But I don't know if any of you all have ever been to the University of Alabama's Museum on the Study of Tobacco and Society, but it's awesome, isn't it? Yeah, I mean, it's awesome. One of the things they have there, they have millions of exhibits down there, but one of them has this gold, they have a gold-clad cigarette case from the Mayo Clinic. It's, you know, as you know, American medicine really promoted tobacco. When the first cool cigarettes came out, they were the first ones that came with a filter, you know, because everybody was doing Marlboros, you know. And there's a picture of a thoracic surgeon with a cool cigarette, and it says he's smoking air that's cleaner than fresh air. And of course, the filters were made out of asbestos. But anyway, Eleanor Roosevelt goes to great lengths in this article to talk about how curiosity makes us better people. It helps us understand problems. It helps us get to better solutions. It helps in our relationships. If I come up to you and I just tell you, hey, I'm Mark Williams. Hey, let me tell you what I do and what I've been and what important things I've done. You're going to like, how soon can I get away from this guy, right? But if I say, hey, listen, what do you do? Where are you from? You know, what interests you? You begin to have a conversation or dialogue. And if you're genuine, if you're face-to-face, if you're authentic, which is a requirement, can't text this, you can't do it very well over a Zoom call, you start build relationships. And people start to trust you, right? Trust issue coming back. That's what I enjoy most about working in my job now. Each day I see 25 patients who are going to have surgery. And it's so fun striking up even brief conversations with them about where you're from. I'll tell you this bizarre story. So I'm talking to one couple. They have moved from Birmingham to Navarre. They've retired. Y'all have grandkids? Oh, yeah, we have 2, but they're so far away. I said, well, wow. What'd your daughter do? She told their daughter was the mom, and they had moved far away. And oh, she's a hospital medicine doctor at UAB. Oh, yeah, you like it? Yeah, they like it okay. But they wanted to live out west, and her husband is an aircraft mechanic. He can get a job anywhere. So my mind is starting to think, this can't be true. And I said, where'd they move? Montana. Where in Montana? Billings, Montana. And then I say, well, you're not going to believe this, but 2 months ago, your daughter, her husband, and your 2 kids, and my daughter and her kids had dinner at my daughter's home. Well, my daughter is a nurse practitioner in Billings, Montana, and they met them and invited them to their home. Now, not all the stories are like that, but when you start exploring things, and all of a sudden people gravitate to you or to the conversation, trust. So if you look at the leadership literature, whether it's Harvard Business Review or anything, you're seeing curiosity all over the place now. Curiosity is a core trait of an organization. Curiosity is something that's vital for a leader going forward, not only in healthcare, but in any industry. And curiosity basically is being willing to be wrong. You know, in some of my positions, and I felt this before, you walk into a room. When I went to Prisma Health, Prisma Health had 4,000 doctors and 40,000 employees, and I'm the first chief clinical officer there and chief academic officer. And you walk into a meeting of 600 people, leaders, and you have this compulsion that, man, I need to know everything. I'm not expected to be vulnerable. I'm not expected to say, I don't know. But over time, you learn that it's a lot easier to say, hey, what do you think? Or I don't know that. It begins to roll off the tongue pretty easy. Great, thank you. We'll skip this one. So you all recognize the setting there and what was going on historically, right? If you haven't seen The Darkest Hour, it's a really great movie. So let's go back to trust a little bit. And who should be the fiduciary of the trustee of the patient, of your neighbor, your relative, your family? It's a hospital administrator? Who should it be? I just asked the question. Do you think the doctor should be responsible for the financial aspects of not responsible for overseeing some of the financial aspects that patients encounter in our system? What do you think? And if not, who should be? I mean, knowing that there's no real price transparency that, I mean. After all, they're the ones writing all the orders, right? You know, when I was at I Foundation about 8 or 9 weeks ago, I get there early. I get there, I'm just an early guy. I get there at 6 o'clock every morning. And so the nurse supervisor there, Brian, said, "Hey, Dr. Williams, when you're there tomorrow, there's a certain patient getting a drug. And before we open up that drug, we want to make sure that patient's okay to have surgery that day." It was just kind of routine, making sure they hadn't eaten and drinking. So patient was fine, had a retinal problem. The drug they were opening, I think, was called Luxturna. How much do you think Luxturna cost? Why was Brian worried about them opening a drug if the patient might not get it? $425,000 per eye. Comes out of your household, guys. So doctors haven't traditionally stepped up into this role, right? And we hear, especially if you're in other parts of the country, my daughters, for example, one in Washington State, one in Montana, the headlines that come out of Alabama often don't tend to be very favorable to Alabama, whether it's healthcare or, you know, we still have chain gangs or we incarcerate more people than anybody around. You know, it's those kind of stories that get out there. Well, this story that came up a while back brought back a lot of pride in what was going on with some aspects of Alabama. You see, none of you all from Tuscaloosa, right? So Pfeiffer Wire was a company that was formed. It's a private company. It was formed by 2 Air Force officers in Tuscaloosa, Alabama, when they returned from World War II. And there was all this aluminum and metals. And they built Pfeiffer Wire into the world's largest supplier of aluminum screens. It's a highly respected company that's always been very community-oriented. And kind of like Alabama Power, their employees tend to spend their tenure of 25 years with the company. So companies like that have long tenured employees, they naturally take an interest in their health a little more than others because they know if they can invest on the front end, they can avoid certain expenses at the back end, especially if they happen to be self-funded. So here was the national headlines about a small company in Alabama helping out their employees with medical debt. Russell Dubose is now vice president of the National Alliance of Employer Healthcare Purchasers. And he said to his employees, "We don't want you to spend money on co-pays, co-insurance, or cost sharing," because he noticed that almost all of their employees were worried about healthcare costs and they weren't able to do their jobs. He said the amount of money they were spending was unacceptable. So what did they do? They said, well, let's start over. Let's have a Kaizen event and let's invite certain people that can help us think totally differently. Maybe demonstrate some curiosity about other ways of doing things. And he had read a book by Dave Chase called Restoring the American Dream that actually provided him a model for this. But they knew that, you know, by 2015, almost 10 years ago, that their glide path for healthcare costs as a company was simply not sustainable. And by the way, that's the same glide path our country's on. It's not sustainable. So they said, well, what do we need to do? As a result of this Kaizen event, they said we need to develop a value-based primary care experience. We need to have transparent data. We had transparent pharmacy benefits. We're going to directly contract with a good surgeon. They send all their joint replacements to a doctor in Knoxville, Tennessee, because his outcomes are spectacular. I think it's Dr. Bonica, I can't remember, Botina or something. They have nurse navigation professionals who go with patients when they hear about their options for cancer treatment so they can better understand what in the world is the doctor talking about. They have brought on-site pharmacy. They have an on-site weight loss program. They have wellness programs. They've done a lot, and they've become a national example by giving testimony front of Congress. You know, if you all weren't paying a lot of money for healthcare, health insurance premiums, would you do something else with that money? You think the state budget would do something else with the money if it didn't have to spend on healthcare? It might spend it on schools or roads or. So that was also a concept introduced by Pfeiffer, was the healthcare dividend. If we can stop spending all this money on healthcare, maybe we can do some other things with it on behalf of our employees. So now they have scholarships to attend college for more than 100 dependents, summer enrichment experience for their children, elimination of all co-payments for the pharmacy, on-site chiropractic and imaging center, and childcare assistance. How many of you all have children in childcare? Can I ask you how much you're paying per month?
Would be 3 of them, probably 50 grand.
Yeah, that's it. So I help, so we have grandkids and they go to daycare. In Washington State, it's $1,500 a month, and here in Birmingham, it's $1,300 a month. How young couples can afford all that, I have no idea. But they're more able to afford it if they're not having to put a lot of money into healthcare expenses. So they've done a lot of great work. So who is the trustee for our patients going forward? Is it an employer like Russell Dubose at Pfeiffer Wire? I don't know. That's just a question. So here is a dumb accident right here. And 2 weeks before Christmas, last set of lights, 24-foot extension ladder. It just rained. I'm normally very safe. I'm an anesthesiologist. I'm really focused on patient safety. I really do. But the lateral forces overcame the downward forces, and the ladder came out. The ladder came out from under me, and it was actually very lucky that I wasn't hurt worse. But when that was on a Sunday afternoon, called up an orthopedic surgeon that I trust, a friend of mine, someone I knew that I trusted. He sent me to a sports medicine x-ray thing. The little x-ray tech comes out and says, "Wow, Dr. Williams, you smoked your wrist." That orthopedic surgeon that I knew and trusted said, "Mark, I'm going to take care of you. I'll have a hand surgeon ready and we'll take care of you tomorrow." Okay. Imagine that you don't have insurance. Imagine that you're just trying to make a little extra money. Imagine that you have a job that requires your hand and you just fell off that ladder and you're thinking, "Oh my gosh, I'll never be able to pay for this. Oh my gosh, who do I see? Will I be able to keep my job?" So how much does something like that cost? Wrist fracture. Oh, we live in a transparent world, right? Hospitals are supposed to give us prices, right? Some people can give us prices for a joint replacement. How much to surgically repair a wrist fracture? What should it cost? What? $5,000. Okay, that's a good start. So I got great care and I had great providers. So I am very thankful for that. And having been chief medical officer for almost every hospital in this city, I still know a lot of people. Most people do not. Most people don't have that advantage. So I go to Grandview. I go to the new surgery center at Grandview. It's really pretty clean, just open. Surgeons own pieces of that, you know. That's okay, but that's our fee-for-service model, right? And the people are super nice. And so Peyton Jones, the PA up there, charged me $459 to do my x-ray and see my hand. And then I had the hand surgeon that my doctor, my friend, picked Dr. Carlo for a hand surgeon. He charged $3,000, but only got paid $959 for 3 hours of operating on my hand, which I thought, I went and talked to him later. I said, "Man, I would have paid you more than that." The surgeon's assistant, James, got paid $130, billed $752. Can anybody decipher how we do this billing process? I mean, you cannot explain this to a normal person. Dr. Kentros, another friend of mine, anesthesiologist, and then I knew Madeline, the CRNA, they all just great care. So I get all this stuff, and of course I got Blue Cross, Medicare Advantage plan. Then I get the bill from Grandview. Now the outpatient surgery center is situated over here in a medical office building. But because of the way our regulations work, the hospital, of course, can charge like a hospital in that setting. That's up for a lot of debate now, the site neutral payments and stuff like that. So I get the bill from Grandview for the 5-hour stay, the 3 hours of surgery. $177,000. I've seen a lot of these types of statements, but even that one blew me away. And, I'm seeing stuff, and again, I know about all this stuff. And I see something like, where's the ondansetron? So here's the ondansetron, and it's $67 for a milligram, 1 milligram. So I got 4 milligrams, so they charge 4 times that. Well, ondansetron only comes in a 4 milligram dose. I mean, you can't get 1 milligram. So this is all just games. And let's say that ladder was defective and I sued the ladder company. They would go after the ladder company for the whole $177,000. And if I didn't have insurance, if it was my son in between jobs, the negotiations with him would start at $177,000. So 100 million people with medical debt. 2/3 of all bankruptcies are the result of medical debt. And a cancer patient is 2.5 times more likely to declare bankruptcy because of medical debt than a non-cancer patient. You can see why there's a national debate to have medical debt taken out of the assessment of your credit score, right? Your credit score determines what you pay for auto insurance, what you pay for home insurance. So you can see the downstream effects of someone who gets a medical bill that they can't pay right off is unreal. Who helps change that? Anyway, that's the opportunity for you guys. And I hope you'll at least become more interested in this, even if it's about talking to patients, even if it's about talking at church, even if it's about talking to your congressman. And don't believe everything that I just shared with you. Check it out yourself. But there's a world of opportunities. If I was 40 years younger, I'd still be right in the middle of healthcare because I love all this stuff. And I've been excited about all the people I've met over the years, and great to be with you guys today. So thanks, Randy. Thank you, guys.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.